Ventura, welcome back. I'm here with Audrey. Audrey, with women, sometimes did you go through a myriad of careers before you end up doing something? And we met Tuesday morning at 8:30. First we interviewed you, and what career did you end up with?
Well, I'm a respiratory therapist with the County of Ventura Healthcare Agency, ambulatory care.
And so I met you as part of a project. What project had you interviewed for?
Our project is Catchrt, and that stands for COPD Access to Community Health.
Well, that sounds like a good thing. So it's for the whole county of Ventura. It's not just the healthcare agencies, really to help everyone in the county?
The whole county, even Westlake.
Well, how many people do we think are affected? I mean, does it kill people in Ventura County? It's just COPD. I mean, people smoke and they cough and.
Yes, it's ranked the third largest cause of death in the county, behind cancer and heart disease.
Wow, so it's not just all about radioactive bombs and Ebola, and it sounds like it's a pretty big health problem.
It is a big health problem.
In terms of, we've had all these taxes on cigarettes and what used to be 50 cents a pack and was $1 a pack. I don't know what a pack costs nowadays. People can still afford to smoke at all?
Well, it's highly addictive, and that's part of the problem.
So are there assets? So as a respiratory therapist, you're not really to run ventilators, but what kind of things do you do in this program?
Yeah, in my outpatient position, I work with first identifying COPD patients across the couny. So we do a lot of outreach. We do a lot of work with hospitals, clinics, senior centers, the VA, et cetera, and we go to their homes and we determine if they're eligible for the program. It is a grant, and it's no cost to Medicare and Medi-Cal patients. The idea is to reduce hospital readmissions of COPD. They can exacerbate quite easily, just based on the lung disease itself. It's very easy to become very breathless, short of breath, have a lot of secretions in their lungs, which can cause a lot of problems.
Well, I know in my practice I take care of a lot of children, and all those children have parents, and those parents have grandparents, and they are worried about grandma and grandpa are still smoking and coughing and doing less, and they're just not going to be around to watch their grandchildren grow up. So are there resources to stop smoking in this county?
There is. We have 1-800-NO-BUTS is the California program, and we have Call It Quits, and that's the County of Ventura program. And I believe they're both free of charge. I know the county program is free of charge.
I understand they can get patches and gums and pills, and I understand there's a gift card too. So
there's a $20 gift card if you remain smoke-free for 6 months.
So that's really important. And for a hospital now, the hospital discharge does not end when they leave the hospital. And that's really what this program is all about. It's the 30 days after, when most of the patients, if they're going to come back, are coming back. And we're going to talk later with another guest about pulmonary rehabilitation and habilitation. And really, and I'm hoping that these sons and daughters of these people can really help them with activities of daily living and getting outside and getting in the park. We hear so many sad stories at our Tuesday morning meetings of people making it from the bed to the chair to sit next to their husband, and they're 55 years old, and that's really all they've got. So.
Right. Well, a lot of attention hasn't been placed on this disease, and so I'm hoping that, and I feel really a lot of optimism toward the ability to assist these patients just in the quality of their life, improving that. There's no cure, so we can do that, and we can make their lives easier and keep them out of the hospital.
Well, certainly there's medication.
Yes.
And so part of what we see is just a lack of adherence to the medication, just remembering to take it there 1 or 2 or 3 or 4 times a day, or there's simpler medications but with more side effects, or they forget to come to their appointments, or or they have coexistent, comorbid diseases. So can they, through the case managers there, do they get access to all the services that they need? You guys will help them with remembering appointments and refills, and
Yes.
so there's diabetologists and
Yeah, keeping their medications, on track, and yes, absolutely reminders, because that is part of the problem, the not doing it. Also, as simple as breathing exercises, that can help a lot too.
Thank you so much for joining us today and talking a little bit about the Catchrt program. Ventura, we're going to be right back.